All right, welcome back. MED200, our assignment week 2, day 2. We'll do a round robin for this one. So when you do your assignment, these questions come from a test bank. So you might get different questions. And this is a review, for the midterm. So it'll cover cardiovascular, respiratory, and reproductive system. So when it's your turn, I'll just have you read the question and then give us the answer. I'll do the first one. All right. Trace the path of sperm from outside world starting with spermatogenesis. All right, so this is abbreviated. So we'll just follow the pathway. If it's not in the list of choices, we'll just go to the next one. So starting with the site of spermatogenesis, that's going to be the seminiferous tubules. Then it is stored in the epididymis. So it's not on this list, so we'll go to the next one. The next part is the ductus deferens. Then entering the abdominal cavity through the inguinal canal, around the bladder to the seminal vesicles. Then it connects with the prostate. Prostate's not on here, so we'll go to the next body part. The next body part is the Cowper's gland, aka bulba urethra. And then out the urethra is not on here. Then we got the tip of the penis, which is the glands. And then lastly, pupus, which is the foreskin. So that's how you want to approach these type of questions if you have it on this assignment or the midterm. All right, in the front, number 2.
Oh, you want me to read it?
Yeah.
Okay. The portion of the sperm that contains the genetic information from the biological father is the head.
Everyone agrees?
Yep.
Yeah? All right, good. So the tail is the flagellum. We got the mid piece that contains the mitochondria, remember, to make ATP energy. And the head contains the DNA. All right, let's go to the second round, sir. Number 3.
The trachea splits into two major tubes known as bronchi. False.
False? Everyone agrees? Yeah? No? Maybe? All right, we'll go to the next one. All right, number 4.
Man, why do I get this one?
Crypto
Crypto
or Chism.
Reproductive is a term for undescended testicle.
True or false? True? Everyone agrees? So crypto means,
Kept inside.
yeah, when the body's in the crypt, it's hidden. Cryptic writing is hidden. Orchidism means testicle. So if your testicle's undescended, is it hidden? Yeah. So not too bad. Not too bad. So the medical terminology will help you on that one. All right, next row, number 5. Yeah.
The inability to conceive after trying for 12 months is termed, I would say first one.
Impotence?
Yes.
Can't get it up
Oh, okay.
for 12 months?
Infertility?
Infertility? You sure? What's ED?
No, I don't know that.
Same thing as impotency. It's erectile dysfunction. And then the opposite of conception, inability of conception. So not too bad. Infertility. All right, next question, number 6.
The fringe part of the fallopian tube is the pancreas. True.
True? Everyone agrees? All right. All right, I'll do number 7. So you got a little reprieve. I'll do the hard ones. All right, same thing as spermatogenesis. We're going to go through the body parts. If it's not listed, we'll just go to the next one. So oogenesis, forming of the egg, occurs on the ovary. It blisters off. It is caught by the fibra ends of the fallopian tube. No fallopian tube. So the next thing is the dome portion of the uterus, which is the fundus. Then we go to the body of the uterus. The neck of the uterus is the cervix. The canal leading outwards is the vaginal canal. Then you have your labia minora. And then lastly, the labia majora. All right, next student, number 8. True or false? We all start off as little girls. True. Everyone agrees? Yeah? All right. Back row, number 9. Go ahead, sir.
Which of the following structures produces progesterone to increase the
Vascularity.
vascularity of the
Uterine lining. This one's tricky. All right, so is it the egg? Is it the ovary? Is it the blister? Is it the former blister? Or is it in your brain? Dun dun dun. If you were to guess, what do you think? What do you guess? 5 seconds. What do you think? Guess. What do you think? Ovary? Okay. We'll submit it and see if it's right. At least you guys know if it's right or wrong. All right, next question, number 10.
The respiratory disease that causes abnormal dilation of the alveolar spaces is
Respiratory distress syndrome. Pneumoconiosis. So that's DUS. Dun, dun, dun. Alveolar spaces. Destroys the lung sacs. If you were to guess, which one would you guess? RDS? Okay. Everyone agrees? Not sure? Okay, we'll go to the next one. We'll submit and see which one's right. All right, let's do this one. Air through the body from the outside world to the capillaries, starting with the nostrils. So that's going to be the nostrils, entering to the nasal cavity where there's the nasal conchae. That's not on here. The nasal conchae increases surface area for humidity. Then we go to the back of the mouth, which is the oral pharynx. No, back of the nose, sorry. Nasal pharynx, then the back of the mouth. There you go, that's better. Back of the nose, back of the mouth, connected to the throat. Then for air to get into the lungs, the epiglottis needs to be up or down? Up or down? Up, needs to be up, all right? So that means it passes the epiglottis next, down into the laryngeal pharynx, where your voice box is, right? So your vocal cords is the glottis, so the epiglottis is above your vocal cords. Closes off the airway when you swallow. So when you breathe in, it has to be open, right? So the glottis is where your vocal cords are. Epiglottis is above it. Then we enter into the trachea, which is your windpipe. The trachea splits into two, bronchi, and when they get smaller and smaller, they're called bronchioles. Bronchioles end in the alveolar sacs, and the alveolar sacs are surrounded by the capillaries. All right, so you got to know the full tracing in order to get the abbreviated tracing. All right, next student, number 12.
The diaphragm relaxes during respiration.
False. Oh, hey, you got a little help? So you agree? Yeah, more than 50%. You're 51 false, 49 true. All right, 13, ma'am.
Which of the STIs has been impacted in the cervical cancer?
So which one do we talk about? Yeah, which one causes the warts?
HPV.
Yeah, so the human papilloma virus. So Gardasil protects against HPV, hopefully protects against cervical cancer as well. All right. All right, two more. We'll do these together. The dome portion of the uterus is called the dome portion. What is it, guys? Cervix? That's neck. So the fundus is the dome portion. A zygote contains 47 chromosomes. So how many should there be? 46. All right, do we answer everything? All right, I'm going to submit this one. We'll take a look at the results. So we'll stick with these answers and then we'll take a look at them real quick. All right, let's submit. Let's see if you guys got these. Good thing about true and false is if you got it wrong, then just don't answer the same question again. The same way. All right, we got a few wrong. We got 3 wrong. Number 1 was good. That was the tracing. Number 2 we got genetic information's in the head. Ooh, the trachea, the windpipe does split. So bronchus is 1. Bronchi means 2. So that's how you'll pluralize those terms. Anything ending in UI ends in I. So at least you guys know that one. So 1 down. 4 is good. Hidden testicle. Infertility, 12 months. The fibrin ends. Fallopian tube. The tracing of the eggs in the outside world, not bad. Ovaries, yeah, we all start off as little girls. 9. Dun dun dun. Which structure releases progesterone? So only during fertilization is this structure maintained to release progesterone. Right? So just review. Ooh, 2 in a row. All right. Dilation of alveolar sac. Which ones damage the alveolar sac? So we know this is DUS. Connie is DUS. So is it SARS or emphysema? So at least 50-50. Just look those 2 terms up. And which one deals with dilation of alveolar spaces? 11 we got. 12. Yep, diaphragm relaxes. So somebody got bailed out on that one. HPV, cervical cancer. Fundus is the dome portion. And a zygote. All right, not too bad. So let me give you guys the access code.